Hi, I'm still Sandra, but now I'm a second year. Nope, that's wrong. Now I'm a third year Doctor of Occupational Therapy student. We are in the home stretch. I graduate in May. I just finished my first level 2 fieldwork, which is my first 12-week long clinical rotation. So I took the opportunity to reflect and see what was helpful in my first 12 weeks as an occupational therapist and what I'll be doing to be successful on my next level 2 fieldwork. And I figured I'd share it all with you too. Or YouTube. That pun was not premeditated. So first, I would recommend being prepared in multiple senses. Before you even start your fieldwork, reach out to your clinical instructor and ask what patient populations, assessments, treatments, or anything else they use day to day. I found it was especially helpful to look over the precautions that might come with certain surgeries, as well as just kind of remembering my general treatment strategies. This is not a time to be broad, so don't look at stroke recovery from acute care all the way through outpatient. Focus on the setting that you're going into. It's also so important to be prepared every day. Give yourself enough time before your day starts to review charts. I know I took a little extra time with this. I was looking up more medical terms, lab values, as well as treatment ideas in the morning. So it was important that I gave myself plenty of time to look over charts so that I could be prepared for the day, because in my setting, we had back-to-back treatments, and I needed any extra time I had throughout the day to finish up notes. Give yourself lots of time in the morning so that you can be prepared. I also found it was extremely helpful to keep a journal of honestly every day. It was nice to look back and see the growth. The things that I was stressed and struggling with the first week were so different than the last week. It'll also be a good tool as I'm preparing for interviewing for OT job to be able to draw on specific patient interactions. I think it's helpful to commit some time to researching and studying, but hot take here, this does not need to be every night. I spent probably max 5 hours a week if I was genuinely personally interested in the topic, reviewing and researching. I also took the time to brush up on skills that I might be using the next day. Fortunately, I was in inpatient rehab, and so I had a sense of what was gonna happen the next day, the day before, so I could know, okay, I'm gonna treat a stroke patient that I've seen a few times. They're gonna need some neuromuscular re-ed. I'm gonna go brush up on a few tools for that. I think that as a student, you just gotta go head first. This is your chance to learn. There were a few times where I didn't wanna look like I was silly or didn't know anything, so I caught myself holding back instead of just trying new skills and making the mistakes while there was someone there to support me. But by the end of it, I learned that I had the knowledge, I had the skills. At the end of the day, this was my place to try them on in a safe, controlled environment. Similar to how our patients are also learning in a safe, controlled environment, we are right there alongside them. Try things that you've never tried before, but like communicate with your clinical instructor and let them know, hey, this is the first time I'm doing this. Maybe not right in front of the patient, like let them know where you want them. Can you be right next to me? This is the first time I'm doing this. Can you just watch and then give me feedback afterwards? This is the first time I'm doing this. Can you be right there next to me to correct me if I do something wrong? Another hot take here, but divorce your textbooks. The real world is not the textbook. You have learned the knowledge and skills that you need to from those textbooks. Now go apply the clinical reasoning that you have because of the textbooks, but don't expect everything to be a textbook scenario. Reciting your textbook doesn't make you a good OT. Ooh, I said it. And I know as a student, it can be so comfortable to feel like you know everything because you can recite the definition of manual muscle testing right from your head. But ultimately, you need to know how therapy works as a whole and be able to apply it. So divorce them. Divorce the textbook. Use the knowledge that you have, but don't expect to be reciting the textbook in practice. Practice communication as well as patient skills. Communicate with your clinical instructor. Like I said earlier, let them know what support you need in every session. Express your thought process. Think out loud. It's helpful for patients to know like there's something going on behind the scenes here. I remember one time I was having a patient stand up the sink to brush their teeth, and I was explaining to my clinical instructor, hey, I'm having this patient stand to work on activity tolerance, dynamic balance as they're reaching for different things. At home, I know they're probably gonna do this activity sitting down, but I'm forcing them to stand here so that we can get a little bit more out of this. That will then apply to different aspects of their health and help them be more independent at home. When the patient was done brushing their teeth, they looked at me and was like, I just thought I was standing to brush my teeth. I didn't realize all these things that were going into it, and I thought you were just watching me stand and brush my teeth. So I think it's a good habit to get into, having your patients know that you are skilled and you're not just having them stand up to brush their teeth because that's what's quote unquote normal. Only gonna help them trust you more. There should be a reason behind everything that you're doing. So express all your thoughts, communicate, let your clinical instructor know what support you need, let them know how you learn, let them know what feedback is helpful to you, what feedback maybe isn't so helpful, and let them know what you're thinking. And do the same with your patients. One thing that I felt very fortunate of is I kind of got the inside scoop on the field. As occupational therapy students, I hope we're not naive to the fact that there are politics and bureaucracy that affect how we practice every single day. And I've heard from other students that their clinical instructors keep them a little bit sheltered from the culture and the policies and politics that are affecting OT practice in their setting. It was helpful to see both the good and the bad side of OT so that I could get a full picture for the setting and also realize how I can be a better advocate for the field itself and for my patients within the confines of the fact that healthcare is a business in the United States of America. As healthcare practitioners, we are operating as members of that business. We still have to provide a service to customers in a way that makes a hospital money. I think at the end of the day, that is the truth, and it's helpful to know how that truth is going to affect you in the setting that you're at, as well as things like company culture, the team dynamics, the whole shebang. So ask about them in a professional way. You don't need to like gossip, but you can kind of start to dive into those details about the behind the scenes of a hospital setting or outpatient setting, school setting, whatever, to get a better sense for how you like the field. Because while we're also learning skills, these fieldworks are a great time to know what setting you might want to practice in. Circling back to the balance, it's important to have balance while you're on fieldwork. A lot of times students are in a new city, new place. Commit to exploring that place while you're there. And if you are fortunate enough to be near your support system, make sure to spend time with those people. Hang out with your friends, do things that you love, go for runs, yada, 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 yada. Your life should never be all work, no play. And it's important to take the time to step away from being a student and learning all the time so that you can be refreshed and better when you're on. And one thing that I kind of forgot to do till the end was soak it all in. I've worked for 4 years of undergrad and 2.5 years of grad school so far to be an occupational therapist, and this was my first time doing OT. It's important to soak it all in and not get too overwhelmed with the fact that you're supposed to be learning and performing to a certain degree, and enjoy the job that you've been working so hard to do. It's a blessing.